Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to English for medical students, non-subject specialists, for the students of the first semester for Tripoli University. Welcome everybody to the second class today. Today, inshallah, we are going to have two topics today. Because we missed, I think, one week or 2 weeks, this is unfortunately out of my hand. So we are going to, compensate the missing classes. So today we are going to take 2 units, inshallah, to try to finish, inshallah, the whole subjects, the whole units from Unit 1 to Unit 15, inshallah, on time. Today, we are going to talk about, as we started with the last time, we started talking about the parts of departments of the hospital, starting to, okay, so if you don't have sound, okay, so this is your first time maybe, if you have to do the following, I'll show you, yes, this image. Look here for the sound. Yes, Selma and Warda. Yes. So you have to yes. So you have to do this. For the sound, you have to press the icon. So here we have the icon here. The icon here. Yes, you have to press the icon, Warda and Selma. There is a join audio. It says join audio. Okay, so Selma is with us. And Warda, yes, you have to do it. So anyone who's, yeah, so okay. Okay, Selma. Maryam is okay. Okay. So this is, yes, this is the icon. Warda, look at the icon, please. Here. This is the icon here. So just press the, yes. Okay, so let us start the class. Now, so for this, so just we resume share. Now we are going to, last time, as I said, we started talking about the departments of the hospital. Today, we are going to talk about the staff. So the staff means physicians, doctors, nurses, technicians. So all the people who are working with you, inshallah, in the hospital. So we have now, today, we are going to talk about 2 floors, the first floor and the second floor in the Heartland Hospital. It is a name of a hospital called Heartland. So listen carefully, and then after that, we are going to answer the questions about the staff of Heartland Hospital. Listen, please.
Unit 2, Hospital Staff. Exercise 5, page 7.
Heartland Hospital. Staff Directory. First floor. Dr. Paul Sartin, cardiologist, surgeon. Office 100. C4, heart disease, heart surgery. Dr. Lydia Greenwich, anesthesiologist. Office 101. C4, surgery, pain relief and preparation. Dr. Richard Collins, chief pediatrician. Office 102. C4, children's health. Dr. Anne Harold, obstetrician. Office 103. C4, labour, pregnancy. Dr. Thomas Locke, chief radiologist. Office 104. C4 X-rays, CT scans. Carol Howard, lab technician. C4 test results. Second floor. Dr. Rowan McNeil, general practitioner. Office 202. C4 general medicine. Carol Simmons, NP, head nurse. Office 203. C4 nursing schedules. Dr. Charles Thiel, pharmacist. Office 204. C4 prescriptions.
Okay, so now listen again, and when you listen one time, two times for the pronunciation, so you can have a better pronunciation for the topic. So here, for example, cardiologist, surgeon, not surgeon, it's a surgeon, surgeon. So when you listen, you can pronounce better. Let's listen again for the second time. Then after that, we try to answer the questions related to this. So we have reading, then we can have the true or false questions. True, false questions, we have three questions. Number one, a patient having heart surgery will visit Dr. Sarton and Dr. Greenwich. So for heart, yes, surgery will visit Dr. Sarton and Dr. Greenwich. Is it a true or false? Two, Dr. Harold is best qualified to examine a sick 4-year-old. Sick 4-year-old means babies. Okay, and three, pregnant women meet their doctor on the second floor. Pregnant women meet their doctor on the second floor. So first we go back again to the first and second floor doctors, and then we can check these questions whether they are true or false. Okay, Warda, you are the only one, I think. Yes, you have to, the icon of listening, there is an icon. You have to, yes, everyone is doing it. Okay, you have to take this option, Warda. Okay, now, listen.
Unit 2, Hospital Staff. Exercise 5, page 7.
Heartland Hospital. Staff directory. First floor. Dr. Paul Sartin, cardiologist, surgeon. Office 100. C4 heart disease, heart surgery. Dr. Lydia Greenwich, anesthesiologist. Office 101. C4 surgery, pain relief and preparation. Dr. Richard Collins, chief paediatrician. Office 102. C4 children's health. Dr. Anne Harold, obstetrician. Office 103. C4 labour, pregnancy. Dr. Thomas Locke, chief radiologist. Office 104. C4 X-rays, CT scans. Carol Howard, lab technician. C4 test results. Second floor. Dr. Rowan McNeil, general practitioner. Office 202. C4 general medicine. Carol Simmons, NP, head nurse. Office 203. C4 nursing schedules. Dr. Charles Thiel, pharmacist. Office 204. C4 prescriptions.
Okay, so we have pharmacists, we have general practitioners, we have lab technicians, we have obstetrics. So we have these, these doctors working in the hospital. Inshallah, one of you or all of you will become, specialists, inshallah. Okay, so for the questions number 1, 2, 3, for the questions 1, 2, 3 for true, false, a patient having a heart surgery in the heart will visit Dr. Sarton and Dr. Greenwich. So what do you think? So you can write, use the notes. No, it is not false, Mariam. It is true, because it says here, for heart surgery, cardiologist, yes, Dr. Paul Sarton, and C4, yes, heart surgery. So Paul Sarton, cardiologist, surgeon. C4, heart disease and heart surgery. So that's the, it's true. So for number 1, a patient, Dr. Sarton. So that's Sarton. So Dr. Sarton. So this is true. So number 1 is big true here. Yeah. Okay. Now, Dr. Harold is best qualified to examine a sick 40-year-old. Sick 40-year-old, that means a baby. So this is number 2. No, yes, yes, yes. Now, Mariam, you are right. So this is false. Yes, not a C, yes. Finally, pregnant women meet their doctor on the 2nd floor. Yes, again, it's not in the 2nd floor. It is in the obstetrics. So it is false. So number 1 is true. Number 2 is false. Number 3 is false. Okay, good. Now we have the second exercise. Let's go to the second exercise. We have matching the vocabulary, the words 1 to 5. So A to E. Yes. So again, okay, for the book, you can go to one of the, we say, booksellers, or we say these, what call them, the photographers in your department. So I don't know, but they have the English book. So you have to ask for the English. So you can have it black and white. Okay, but this one is, we say, as a PDF. So you can have it, yes, you don't have a book. Well, anyway, you have to prepare yourself for this. Okay, so you have to buy a sheet. It's not a sheet, it's a small book, 22 or 25 pages. It's not a big one anyway. Okay, now let's go and do the exercises here. So we have a lab technician, anesthesiologist, general practitioner, nurse, and pharmacist. So number 1, lab technician is the person. Lab technician is number A, B, C, or E. Yes, a medical professional who works with samples in a laboratory. So this is C. Yes, anesthesiologist. So anesthesiologist, a person who, yes, a doctor who renders patients unconscious or prevent them from feeling pain. Yes, so number 2 is B. Very good. Yes, Mariam, good. Rawasi, good. Yes, and number 3, general practitioner. A general practitioner is a doctor who provides many kinds of care to adults and children. So this is A. Yes. Muhammad, okay. Muqin, okay, good. Rawasi, good. Yes. And number 4, nurse. Nurse is number, yes, nurse is number D. So a medical professional who helps a doctor and cares for patients. Finally, of course, it is E, a pharmacist. E, a person who fills prescriptions and gives medicine. So these are the 5 types of, we talked about 5 types of professionals who work in a hospital. Then we are going to deal with vocabulary. So question number 4. So read the sentence and choose the correct word. Number one, the radiologist the pharmacist has prepared the x-rays. So which one, radiologist or pharmacist? Okay, good, guys, you are very fast. Yes, so it's a radiologist. So this is the correct answer. Pharmacist, no. And number 2, the lab technician and pediatrician. Yes, treated me after my heart attack. Is checking on the 3-year-old. So it's not the lab technician, it's the pediatrician. So this is the correct one. A great obstetrician, cardiologist, treated me after my heart attack. So this is the cardiologist, not the obstetrician. And an anesthesiologist and obstetrician says the baby is doing fine. Okay. Is this number 4, is it okay if I say both are correct? If we have a surgery for a baby, so the anesthesiologist maybe says the baby is fine, or the obstetrician maybe he says fine. So because surgeries can happen to babies, and of course, yes. But anyway, let us choose the obstetrician, the baby, because it's a baby. Okay. Now, and finally, Dr. Brown is a famous transplant. He's doctor, of course. So not a nurse, is a surgeon. He said doctor. He said doctor, surgeon. Yes. Yes, Muqin. Yes, Mariam. Good. Okay. Now we go to the second listening. Now we have, as usual in every chapter, we have 2 listenings. Now we are going to listen to a conversation between a doctor and a nurse. So we are going to listen to a conversation between 2 people. One of them is a doctor and the second one is a nurse. And we have to choose the correct answer. Number 1, what is the main idea of the conversation? So what is the main idea? Is it about a patient's appointment? Is it about a patient's missing chart, or a patient's blood pressure, or a patient's general practitioner? This is number 1. So what's the main idea? Appointment, missing chart, blood pressure, general practitioner. Then question number 2, what will the woman likely do next? Examine the patient, call the cardiologist's office, take the patient's blood pressure, lead the man to the patient's room. So I want you to listen carefully. We are going to listen 2 times. Then after listening, please, I want you to choose the right answer. Listen, please.
Exercises 6 and 7, page 7.
Dr. McNeil, could you come over here for a second?
Sure, Carol. What do you need?
I just took Ms. Grayson's blood pressure. It's 150/92.
That's a bit too high.
Yes, I thought so too.
Who's her cardiologist?
Her chart says it's Dr. Sartin.
He'll want to know about this.
I'll let his office know to set up an appointment.
Good idea. Thanks for consulting me.
Okay, listen again.
Exercises 6 and 7, page 7.
Dr. McNeil, could you come over here for a second?
Sure, Carol. What do you need?
I just took Ms. Grayson's blood pressure. It's 150/92.
That's a bit too high.
Yes, I thought so too.
Who's her cardiologist?
Her chart says it's Dr. Sartin.
He'll want to know about this.
I'll let his office know to set up an appointment.
Good idea. Thanks for consulting me.
Okay. So for question one, yes, very good. Yes, you are very fast, guys. Yes, very good. Fauzi. Yes, Mariam. So, and also we have, I just want to, Fauzi, Mariam, Fauzi. Okay. Salma. Muhammad. Okay, so number one is C, patient's blood pressure. And the number two, what will the woman likely to do next? It's B, call the cardiologist's office. Okay, so now we have the same part of listening. Again, we are now going to have to check your ability of writing. So I want you to listen and write the missing words. So I want you now to write. So here we have Dr. McNeil, and we are going to listen again, and then we write the missing words. Okay, let us stop the video.
Exercises 6 and 7, page 7.
Dr. McNeil, could you come over here for a second?
Could you come over here? Yes. For a second. For a second. Yeah. So Mariam wrote number 4 and the letter S. Okay, but in the future, inshallah, you are going to have some, we say, listening tests. So you can't say just number 4 and letter S. So you have to write, yes, number 4 maybe, yes. Number 4 is number 4. You can write it anyway, but in the future, no, you have to write for a second. But now it's okay. Good. Number 2.
Sure, Carol. What do you need?
I just took Ms. Grayson's blood pressure. It's 150/92.
It's 150 over, yes, 92. It's 150 over. Good. Well, 150 is written, Muqan, very good. But okay, thank you for writing it in detail. Number 3, sorry.
That's a bit too high.
So that's a bit, okay, TOO, high. A bit too high. Okay, 4.
Yes, I thought so too.
Yes, I thought. I thought so. Thought so.
Who's a cardiologist?
Her chart says it's Dr. Sartin.
He'll want to know about this.
I'll let his office know to set up an appointment.
Good idea. Thanks for consulting me.
So who's here? Number 5. What is number 5? Who's here? Cardiologist. Who's her cardiologist? He'll want to know. Yes. Her chart says it's Dr. Sartin. He'll want to know about this. About this. Okay. So this is what we have for the, yes. Now for the grammar for the language. So we have what's called direct questions. So we have here the direct questions. So here, for example, when you talk about language use, so we say, can you come over here? Or you can say, please, can you come over here? Yes. What do you need? What do you need? So if you ask about, I need an injection, I need to check her pulse. If the nurse asks you, what do you need, doctor? So I need, we say, a blood test. I need an X-ray. What do you need? Then who, to ask about the subject here. So we say, who's her doctor? Okay, or who's your doctor? So who's her, who's his, who's her doctor? And if I ask you about yourself, who's your doctor? Who is your patient? Who is your pharmacist? Who? So I ask about that person. Dr. Ali is my pharmacist, my doctor. Dr. Let's say Fawzi, let's use Fawzi here, is my cardiologist. So here, who I ask about. Yes. So if I have a problem, I say, what do you need? What's your problem? You can say, well, the patient's blood pressure is too high. Okay. Can you come over here, please? Or please, can you come over here? So this is when you say please here, or you can just say here, please. So you can say, can you come over here, please? Or please, can you? So to be nice and polite. Okay, now we are going to go to the next chapter. Only these 2 classes, guys, maybe this week and next week. Then we go to have lesson by lesson to finish the curriculum, inshallah, on time with your final exams, bi'idhni ta'ala. So we have to finish. So that's why I'm taking 2 classes now, because as I said in the beginning, I missed with you 2 weeks. So we have to cover these 2 weeks. Okay, now we have, we talked about staff, we talked about department, hospitals department, we talked about hospitals staff, like the doctors, physicians. Now we have Unit 3, some of the equipment used in hospitals. And of course, you have to know the things. Of course, each hospital is full of, we say, equipment, and we are going to talk about some of them. So medical supplies. So we are going just to make it, yeah, so the in front of you. So we are going now to listen again to an audio listening. So in this audio, we'll have all the vocabulary related about hospital equipment. Then we have the vocabulary. Then we finish the true, false, or yes, the questions. Then we select the correct answer. Then we listen to a conversation again about these hospital equipment. Then, as usual, we finish the class with writing the missing words. Listen now, please. Listen carefully about, we have here some vocabulary like wheelchair, pressure mattresses, bedpans, syringes, sharps containers, gauze, latex, gloves, so biohazard waste container. So these are some of the vocabulary which we are going to listen to. Listen, and then we are going to do the vocabulary exercises.
Unit 3, Hospital Equipment, Exercise 5, page 9.
Medical supplies. Please keep everything in its proper place. Large items such as wheelchairs and pressure mattresses are at the back of the room. Supplies for patient rooms, such as gowns and bedpans, are on the left. Syringes are on the top shelf on the right. Dispose of used syringes in the sharps containers. Gauze, latex gloves and other examination supplies are under the syringes. Dispose of these items in a biohazard waste container. If any items are out of stock, please submit an order form to the front desk. Oxygen tanks for patient rooms are on the second floor next to surgery.
Okay. Listen again.
Unit 3, Hospital Equipment, Exercise 5, page 9.
Medical supplies. Please keep everything in its proper place. Large items such as wheelchairs and pressure mattresses are at the back of the room. Supplies for patient rooms, such as gowns and bedpans, are on the left. Syringes are on the top shelf on the right. Dispose of used syringes in the sharps containers. Gauze, latex gloves and other examination supplies are under the syringes. Dispose of these items in a biohazard waste container. If any items are out of stock, please submit an order form to the front desk. Oxygen tanks for patient rooms are on the second floor next to surgery.
Okay, so we have now for example, if we look at the oxygen tanks, the syringes, wheelchair, the pressure matrix, the gauze. Biohazard means danger, dangerous. When I talk about dangerous supplies, like chemicals, like sharp, we say sharp things like we say sculptures, or they have razors or scissors or anything which is material sharp, or biohazard chemicals again. So you put them in a very we say a container, very special container for safety issues. Now let's answer the first questions. So number 1 is read now the supplies, the supply room poster, then mark the following statements true or false. So we are going to listen to it again. Then question number 1, the storage room cannot hold large items like pressure mattresses. Is it true or false? Number 2, oxygen tanks are stored in patient rooms. Number 3, syringes should be disposed of in a biohazard waste container. So let's listen and then answer the questions 1, 2, and 3.
Unit 3, Hospital Equipment. Exercise 5, page 9.
Medical supplies. Please keep everything in its proper place. Large items such as wheelchairs and pressure mattresses are at the back of the room. Supplies for patient rooms, such as gowns and bedpans, are on the left. Syringes are on the top shelf on the right. Dispose of used syringes in the sharps containers. Gauze, latex gloves and other examination supplies are under the syringes. Dispose of these items in a biohazard waste container. If any items are out of stock, please submit an order form to the front desk. Oxygen tanks for patient rooms are on the second floor next to surgery.
Okay. So for number 1, what's your answer for number 1? The storage room cannot hold large items like pressure mattresses. Yes, it can handle, so this is false. Number 1, false. Oxygen tanks, number 2, are stored in patient rooms. No, it is not in the patient rooms. So again, this is false again. So number 2, 1 is false, 2 is false. Syringes should be disposed of in a biohazard waste container. Yes, because syringes are dangerous. So yes, should be disposed of in a biohazard waste container. So this is true. Very good. Yes, so this is true. Good. Now we deal with the vocabulary. We go to the vocab now. So we have syringe, sharps container, biohazard waste container, gown, and gauze. So number 1, what is the answer for number 1? Syringe. Yes, so we have, very good. So for syringe, it is D. D, a device used for injecting liquids into the body. Sharps container. Yes, sharps is C. It is a box for the a box for the storing of used needles and other sharp medical instruments before disposal. Then biohazard waste container. Biohazard waste. So number 3 is what? What do you think number 3? Yes, very good. It is E. 3 is E, a box for the storage and disposal of dangerous medical waste. Gown, 4. 4 is B, a long robe worn by a hospital patient. So that's B. And finally, gauze is A. A gauze is a cotton fabric used to cover wounds or surgical incisions. Okay, so incision. Okay, incision is when the doctor cuts. So it's a cut here. So if the doctor cuts the so-called incision. Okay, now very good. Now read number 4, the sentence, and choose the correct word. Number 1. Wear a new pair of what? Gowns or latex gloves to examine each patient. So what to wear? Pair of what? Pair means 2. Is it gowns or latex gloves? So Gowns, you know, gown pair. A gown is what? A gown is like a long dress, so you don't wear two. It's the latex gloves. So I'm talking about here two, pair. So here, pair of latex gloves. Okay. Yes, latex. Two, an oxygen tank, a wheelchair helps Mr. Hayes breathe. Yes, it's the oxygen tank for breathing. Yes. Three, the bedpans, latex gloves in this room need to be emptied before you leave. The headbands, the latex gloves. So here we have the bedpans. Yes, so we should empty. Number four, please get Mr. Wilson a bedpan wheelchair so he can move around. Move around. So that's, yes, so that's a wheelchair. Order a pressure mattress, oxygen tank for Miss Jones. Ms. So this is here, we pronounce it as Z. Ms. Jones, to help her back pain. So that's a pressure mattress. Now, this is the, yeah, so so far so good. The vocabulary is not very difficult in the topics. Now we are going to listen to a conversation between two nurses. By the way, the word nurse in English, nurse, is used for males and females. In Arabic, no. We have mumarrid, mumarrida. In English, no. Male, he, nurse, he's a nurse. She's a nurse. So nurse, nurse. So no change in the pronunciation. Now, number one, what are the speakers mainly talking about? So the two nurses are talking about ways to use less supplies, how to organize the storage closet, supplies that need to be replaced, how properly dispose of syringes. Two, what will the man likely to do next? Or what will the man, likely do next? Empty the sharps containers, check the exam rooms, find the new latex gloves, order more syringes. By the way, when you say man here, we mean the nurse. No man in here. We have a conversation between two nurses. Okay, I want you to listen. Again, we are going to listen 2 times. Then please answer questions 1 and 2. Listen, please.
Exercises 6 and 7, page 9.
Gary, have you done your supply checks for the day?
Yes, I just finished them up.
Are we short on anything?
Yes, we need some more latex gloves in exam rooms 1 and 3.
Okay. Anything else?
There are only a few syringes left in the storage closet.
Okay. I'll have to order some of those. That reminds me. Don't forget to empty the sharps containers before you leave.
Will do. See you tomorrow, Carol.
Okay, so we have a he and a she. Nurses, listen again.
Exercises 6 and 7, page 9.
Gary, have you done your supply checks for the day?
Yes, I just finished them up.
Are we short on anything?
Yes, we need some more latex gloves in exam rooms 1 and 3.
Okay. Anything else?
There are only a few syringes left in the storage closet.
Okay. I'll have to order some of those. That reminds me. Don't forget to empty the sharps containers before you leave.
Will do. See you tomorrow, Carol.
Okay. So number one, Muhammad, are you sure? It is B. What are the speakers mainly talking about? So it's about actually they talk about the supplies. So supplies that need to be replaced, not A, no. Okay, listen again. Listen again.
Exercises 6 and 7, page 9.
Gary, have you done your supply checks for the day?
Yes, I just finished them up.
Are we short on anything?
Yes, we need some more latex gloves in exam rooms 1 and 3.
Okay. Anything else?
There are only a few syringes left in the storage closet.
Okay. I'll have to order some of those. That reminds me. Don't forget to empty the sharps containers before you leave.
Will do. See you tomorrow, Carol.
And for number two, it is, she said, don't forget to empty the sharps containers. So number one is C, number two is A. Okay, we are going to listen to it again now because, as you know, we have to fulfill the conversation here. So nurse one, Gary. So that's Gary. And yes, so let's listen.
Exercises 6 and 7, page 9.
Gary, have you done your supply checks for the day?
Yes, I just finished them up.
Are we short on anything?
Are we short? Are we short on? Are we short on anything? Are we short on anything? So number two.
Yes, we need some more latex gloves in exam rooms 1 and 3.
Yes. We need. We need more. We need more latex gloves in exam rooms 1 and 3.
Okay. Anything else?
Okay. Okay. Anything else? Anything else? Very good.
There are only a few syringes left in the storage closet.
There are only few syringes. There are only few syringes left in the storage closet. There are only few syringes left in the storage closet.
Okay. I'll have to order some of those. That reminds me. Don't forget to empty the sharps containers before you leave.
That reminds me. That reminds me. Don't forget. Don't forget. Don't forget to. Don't forget to empty the sharps containers before you leave. Will do. The last one.
Will do. See you tomorrow, Carol.
See you tomorrow. See you tomorrow, Carol. Okay. So as we had already taken today, we have, we say, simple topics. And number 2, yes, we need more latex gloves. No, that's what we have. Okay. Number 2, we need more. We need more. Yes, we need more. But more is written here. We need more latex gloves. So it's written. Yes. Anyway, thank you for thinking about this. Okay, now for the language. So for the language needed, for the language speaking, so use language such as we need some gloves, we need some latex gloves. Don't forget to empty the, don't forget, it says, don't forget to empty the sharps containers. Don't, we need some, we say, let's say gloves. Don't forget to empty the sharps container. That reminds me, if I say that reminds me, could you call Dr., let's say, Sam? Yes, so that reminds me, could you call? So I say that reminds me, so you remember something in here. So this is just, we say, a nice way to talk to people. As I said last class, or the first class, if you want to develop your language, you have to listen every day to anything in English for 20 minutes. So 20 minutes will be more than enough. So you can just listen every day to anything in English, because the pronunciation is the same, grammar is the same. The only changing thing is the new vocabulary. So when you use new vocabulary, so you are going to have more practice. Your subject specialist, you are really good guys in medical terminologies. You are studying different topics. But as I said in the class number 1, your problem is in communication. How to talk about your ideas, how to communicate with other patients and also other people who are doctors or working in the medical profession. Anyway, today we don't have, I'm not going to give you grammar, maybe next class. So as I said, the topics, we are going to take 15 topics, 15, the whole book. So these are the topics, and we have a little, we say little grammar. Yes, without translation. Yes, when you talk, you have to speak in English, especially when you travel, when you travel abroad or when you work in a hospital. So some people, they don't know how to use Arabic. They don't speak Arabic. So you have to communicate. So you have to be nice. So if you talk to a nurse, you say, please, we need some gloves. Don't forget to bring the medicine. Don't forget to call Dr. Sam. Could you call Dr. Sam? Could you call Dr. Ahmed? So could you please, or could you call? So this is, we say nice and gentle request. We don't say call Dr. Sam, no. Could you please call Dr. Sam? Or please do call Dr. Sam. So we have different ways to use the language. As I said, guys, you have to use the language. First is listening. The second is speaking. So input, output, input, output. Inshallah, I'll send a link to your representative, the person who represents you, about how to study by yourselves. I have many material. I have, too much materials, too much, we say, data. And you can have these different materials. You can download them from the internet for free, no money. Then you can start learning the language 20 or 30 minutes every day. No more, no less, 20 minutes a day. Thank you for being with me. And inshallah, I see you all well and in good health next week. مع السلامة.